How you doing, YouTube? Nick Pratap here from Next Gen Rehabilitation, and in today's video I'm going to be going over what to expect if you're in a cardiac rehab exercise program. Now, for those of you that have recently been referred over by either your GP, your cardiac specialist, the reason they're sending you over is a few. Either you've had some sort of coronary diagnosis, either a heart attack, a heart failure, valve replacement, some stents put in, whatever it may be, or your primary prevention, which means you're at high risk of developing heart disease based on your lifestyle, your gender, family history, any multiple factors. Okay, so the first thing I want you to know, and again for all different settings, is it's a good setting to be in for exercise. Okay, you're going to be followed by multiple people in the healthcare profession, including doctors, cardiologists within the program, nurses, depending on which program you're in, either weekly visits or monthly visits with a dietitian. There's a social worker, psychiatrist involved, and of course the exercise component with the clinical exercise physiologist. So how it typically works when you come in your initial assessment is you're going to be sitting down with the exercise physiologist. And the whole purpose of sitting down with the exercise physiologist is to get a sense of your history. So in terms of cardiac, what happened to you, your past medical history. So does this individual have any other issues in terms of chronic disease, diabetes, COPD, history of cancer, that sort of thing. We're going to look over any limitations the individual may have in terms of exercise. Is there any musculoskeletal issues, back problems, neck issues, any past motor vehicle accidents? We're going to go over their medications with them, ask if any problems in terms of side effects, how they're coping since the episode, and how they're managing their medications. We usually go over a blood work profile and different cardiac tests that they've had done in the past. A lot of the times they would have already gone over this with their primary cardiologist, but we just go over this in terms of reassurance and letting them know that we're going to be using some of this information, especially the information from the treadmill test, to be able to make an exercise prescription for them. Okay, so after they see us and we go over the goals and we talk about the program, then they'll go ahead and they see the cardiologist. Okay, and with the cardiologist, it's more of a physical examination. They dive a little bit deeper into the medications and they adjust any medications as needed. After that, we have the patient come back in a few weeks, depending on how the classes look, and they're ready to start. Okay, so different programs have different settings. The one I work in, we do exercise once a week for a period of up to 6 months, 1 hour sessions, and the patient actually has an opportunity to drop in once they start feeling more comfortable. So the breakdown of the class: when you first come in, what you're going to do is your pre-vitals. Okay, so we're going to test your blood pressure. We're going to go over your heart rate just to make sure at rest they look good. We're going to test your blood sugar both pre and post if you're diabetic, or if you have impaired fasting glucose, just to make sure that your sugar levels are in appropriate ranges. For the first 2 to 4 classes, we hook you up to the telemetry system, and what that is, it's basically a way for us to monitor your heart rhythm and rate while you're exercising. So your heart rhythm and rate is going to be on a screen. It's going to be running through the entire class. It's a wireless connection. And at the end of class, your exercise physiologist is going to go back and have a look at that to see if there were any problems or concerns. And if there are, they will follow up with you the following week and talk to the doctor if there's any underlying problems. When we start the class, we start with a group warm-up. Now, this can be done either on a machine, or you can choose to do it with our fitness instructor. So with the fitness instructor, it's a full body dynamic warm-up, incorporating movements on the upper body, the lower body, very basic movements. Now, if you feel like it's too fast for you, again, we never recommend trying to keep up with the fitness instructor. If you're finding it to be too quick, you take it at your own pace and you do what feels comfortable for you. That's going to last about 10 minutes. If it was too much, we can always warm you up on a machine. After that, we do about a 30 to 45 minute conditioning phase, which incorporates 3 different machines, 10 to 15 minutes each. And when you're on the machine, we tell you exactly what you're going to be doing, how hard you're going to be pushing yourself, how your heart rate should be responding, how you should be feeling. that's all going to be set up for you, okay? You're going to do that for the 15 minutes. We're going to explain your target heart rate range and exercise loads. After that, we move you to the next machine and you repeat, and then we do that one more time at the end. Okay, so 3 different exercises. Once that's done, the class gets together again and we finish off with a group cool down. So in the cool down, the fitness instructor is going to go over some weight training exercises for about 7 minutes, 7 to 10 minutes. They're going to do some breathing exercises. And then we finish off the class with a little bit of balance work and stretching. Okay, so the whole cool down lasts for about 15 minutes. Now, again, if there's anything that you feel like you can do, the fitness instructors and the exercise physiologists are really good at creating variations of different exercises. Say, for example, you can't lift your arm up or lift it off to the side for whatever reason with a weight. We're going to get you to just do it range of motion, okay, and to the best of your degree. At least that way you can still be involved with the same exercises and just in a different variation. Once that's done, at the end of class, we do a post-vital check, okay? So one will check of blood pressure, one will check of heart rate. Again, if you're diabetic, we're going to check that blood sugar. Your case manager, your exercise physiologist is going to go over the layout of the telemetry to see if there's any underlying concerns. And as long as everything looks good, you're free to go. And then you come back the following week and we repeat the same process. Now, every week, your case manager is going to be looking at your file. We're writing notes, again, based on how you did on the machines, how high your heart rate got, how you felt, if there were any concerns in terms of the muscle or the heart or your breathing, and we adjust your program accordingly, okay? But our goal, obviously, is to try to progress a little bit every week. So let's say, for example, you came in the first week and we're doing level 1 at 40 revolutions per minute, and you're like, Nick, this doesn't feel too bad. Then the next week I might up it for level 1 at 45 to 50 revolutions per minute, and then the following week we might go level 2 at 50 or whatever, right? So we're going to continuously increase, but it's based on how you feel. So hopefully this video helps out. If you have any more questions, feel free to send me a message. And until next time, this is Nick Pratap from Next Gen Rehabilitation.